Welcome, everyone. This is Walt Kasmir, leading gerontologist and certified senior advisor. Today's episode, we are interviewing one of my favorite people, and she has had the privilege of getting to the age of being eligible for Medicare. And like many people, she has a question that many people have about Medicare. So we had a briefing behind the scene, and she told me she had one primary question. So without further ado, we are going to allow my favorite client to ask her questions about Medicare. And before we do, I do want to make a disclaimer. I am not a financial planner. I am not selling any financial instruments. Everything is for educational purposes only. All right, my love, go ahead and ask your questions. I am ready.
So my question is, I'll be 65 in 4 months. And I know I have at least 3 months before and after to apply for Medicare. However, I am still working full time. I do have medical coverage. And I've read somewhere where it says that if you don't apply for Medicare during a certain period, that you can be penalized once you become of age, and you would be penalized for the years that you hadn't paid when you should have paid. So I guess my question is, do I really need to have Medicare? Because I hear sometimes you don't need to. So I'm just confused with if I should and if I shouldn't, and when I should.
Very good question. And many people have that exact same question where they're still active and working, and they have the option of having benefits with their employer or Medicare. Now, again, I am making a disclaimer. I am not selling any insurance plans. I am not a financial planner. I do not get reimbursed from any company for doing this episode on how to choose a Medicare plan for educational purposes only. So to answer your question, I like having executive summaries. The executive summary is, in general, Medicare is usually a better paying plan than most employer-sponsored plans. Now, you can tell me the truth. Did you watch any of my video that I gave you the link to before to kind of explain the different options?
I did, and I should have taken notes while I did.
That's
I said I
okay.
was going to look at it again and then take the notes and write the questions.
Well, that's why I made the video, so people can do that.
Yeah.
And again, I made that a few years ago, but I believe that the fundamentals of the framework of conventional versus advantage plans would remain basically the same. I mean, it's the government and insurance companies, and they're always trying to improve their product offerings. But the fundamental framework for making your decision, I think, will be evergreen. But in general, Medicare plans have better coverage. And in general, now you have to compare your plan that your employer is offering to what you could end up paying with either option of Medicare. But in general, Medicare should be more affordable. And as I said in the video, and I will add links to the videos that I made a while back. But in general, it's basically you have two options. You have one option is conventional Medicare, and then you have to get Medicare supplements to pay for the part that doesn't get paid for just the basic Medicare. Then you have on the other side what they call advantage plans. Basically, insurance company manage Medicare. Excuse me. And what they really do is it's a HMO or PPO, but it's some type of network, just like the insurances that we're accustomed to. So they try to put together a package plan that includes the medical, the dental, the hearing, the eyeglasses, and other perks that the basic conventional Medicare doesn't have on its own. You have Part A and Part B. One covers the doctor's bills, one covers the hospital bills, and then Part D for drugs covers the prescriptions. But it still leaves things that aren't paid for. You'll have deductibles that aren't paid with the basic plan unless you get a supplement, and dental, vision, hearing aids, those things are not included. So you have to get supplements added on to that conventional Medicare plan. As I mentioned in the video, I go in more depth, and I have some pretty good diagrams. I'm not an artist, but it's the best I could do. But I do try to explain that if you want to travel and you need to be able to go anywhere, you don't want to be restricted by having to be in network, then a Medicare plan may be the better option. If you want to have possibly lower or no co-pays and premiums, then you could go with a Advantage plan. Of course, you're going to get what you pay for, but you will be restricted to that specific network. So the rule of thumb is, to every question, is it really depends based on your scenario. But for the scenario that you're talking about, you have to go and look at your plan and look at the one that you chose with the deductibles that you have, and it allows you to go to the doctors that you need to go to, get the drugs that you need, and the premium and the co-pays and the deductibles, all additional expenses. You got to compare those, and somebody from personnel, or if they have a third party company that they outsource to, someone should be able to explain that to you in plain English. And they should really be well versed enough to compare it to a Medicare plan. Now, there are people who work for various agencies who can explain Medicare until you turn blue for free. I will put the links in the description below for the YouTube, but it is called the SHIP program, and every state has a insurance program that their main goal is to explain every Medicare question that you would have. But I wanted you to have a primer, so it wouldn't be the first time that you heard that information, so you would be empowered and be able to make informed decisions. But and especially, considering your specific medical conditions, you got to compare, do I like the plan that I have? Can I tolerate what it costs? Or can I get the same coverage or better, maybe even less, with a conventional Medicare plan? Now, the specific question that you asked about that penalty is true. You can say, hey, I'm going to be Miss Independent and keep working and use my employer-based insurance. But each year that you delay joining, you basically miss out on a percentage that they would have been paying.
Mm-hmm.
So, for example, let's say it's 2%. So you say, fooey on that, I'll do it next year. And they say, fine, we'll call you back next year and we'll notify you for the enrollment period and get you squared away. But now, next year, you pay 2% more on your premium.
Mm-hmm.
You're feeling so good, you start exercising and getting all cut and energetic, and you work 2 or 3 more years. So now, 3 more years, now you are paying 6% more, 2% for each one of those years on that premium. And they're going to go up as much as they can. I mean, that's what insurance companies do. So I love executive summaries. So my executive summary to answer your question is yes. If you don't want to pay those additional percentage penalties, basically, each year that you delay, you should consider going for Medicare now.
It's like a catch-22, though. You ask the question: should I apply for Medicare now, or should I apply for it later? And I guess there's benefits to both. However, I guess that penalty, and I'm thinking.
So I'm thinking, we'll get you connected with a SHIP advisor, and ask the specific. Get your policy out and have it ready side by side, and say, this is my policy. Or maybe you can screen share something with them and say, this is the policy. How much am I really going to have to pay? How much is it going to cost me to delay enrolling each year? Because it's a percentage. I want to say around 2%, 2 to 5. It just depends. You can't hold me to that, but it's a give or take. It's around there, but it is a percentage per year that you delay.
But who would want to delay Medicare at the expense of being penalized?
Some people, maybe they are gainfully employed white collar employees, and they have great benefits. Maybe if you worked at a top 100 company, and they pay 100% of your deductibles and co-pays, and you only pay $5 per prescription or something like that. That's why you would want to say, hey, I'm staying with them. But if you work for the average company, and every chance they get, they're increasing your premiums, increasing your deductibles, increasing your drug costs, then that's when you say, let me jump off of this ship and go ahead and get Medicare. Are they going to change? They're going to change some, but not as drastically as the HMO or PPO run insurance plans. So, like I said, we can get you hooked up with a SHIP advisor. And I mean, this is all they do all day long, is talk to people about Medicare in your specific state. But I definitely wanted you to have a primer on the fundamentals of how this whole thing works before you talk to them. But like I said, for you, it will boil down to, is my employer-sponsored plan more affordable? And does it provide the benefits that I want, compared to going ahead and choosing a Medicare option? And what would that actual percentage penalty be in dollars? Not general vague terms, but they should be able to calculate it for you or say, well, hey, give me the information and I'll get back to you on that. But they should be able to give you some specific information on how much the penalty would cost in your state.
Mm-hmm. Okay. Well, and we got the new, oh shoot, not guidebook. What am I trying to say? It shows what the rate is of your premium, your deductible, the HMO, low deductible, high deductible. There's different things. Kaiser.
Now, did you get that from your employer, or that's information from Medicare?
From my employer. This is
okay.
The county's insurance. And I was looking over, because right now I have Kaiser HMO.
Mm-hmm, mm-hmm.
And it looks like they have probably gone up $20 per pay period.
I'm not surprised. I mean, that's what they do.
So, I mean, yeah, I need to.
And so I'm sure that your pay won't keep going up proportionately to the increases in your premiums and your co-pays and deductibles and all that.
Exactly.
So if you have that in front of you, and then you can give that ship advisor some specific numbers,
mm-hmm.
that is going to help you dial in and say, okay, I can see it in black and white. How much this is going to cost me to stick with this program versus choosing my Medicare and like I said, we don't have socialized medicine, but from my experience, the Medicare is regulated. The CMS, they regulate that, and so it's going to be more stable than a privately held insurance company managing a Medicare program. Like at the time I made that video, they were calling them Advantage plans. They might have some new fancy term for it, but they're still HMOs or PPOs, some type of network-driven program that manages the Medicare program for them. And so basically, again, you have the option of conventional, where you need to get a supplement to fill in the difference of what they don't pay for. And while people are listening, I hope you are listening. If you haven't listened to anything, listen to this. Medicare will not pay all of your bills. It's only going to pay a percentage of your bills. So you will need a supplement plan to cover the difference of what they don't pay if you go with the conventional Medicare plan. The Advantage plans or the private insurance PPO, HMO type plans, their appeal is that they combine all those things together to make it simpler. And again, none of it is free. It's still going to cost. But in general, it's my opinion that a Medicare option is going to be a better option, more affordable, better coverage for the average person. If you have the average package that your employer picked for you, pound for pound, you should be able to get a Medicare plan that provides that same coverage or better coverage for the same or less money, or at least more predictable premiums.
Well, now there's the Medicare Part B.
Yes.
And I believe that right now is $148.50.
Okay.
Next year to be going up to $158.50.
Of course.
So, and I know my insurance packet, I know I'm not paying that much for my vision, for my dental, for my medical, for my hospital. So.
And so you wear glasses, so that's important for you. I know you want to keep those pearly whites, so going to the dentist And honestly, since I worked for the fire department 20 years ago, where we had a real union and we had good benefits. Everywhere I've worked since for the last 20 plus years, dental has been the weak link in the whole compensation package. I mean, the last job I had, I think they covered about $1,200 worth, which was about one visit to the dentist.
Mm-hmm.
So, and that's what you have to look at is, okay, am I planning to go to the dentist in the next year or two and, get extensive dental work? And how much would it cost me with this employer plan, or how much would the Medicare option cost me? Whether it be the Advantage plan or the conventional plan with the supplements. So that when I was saying the answer to every question is it depends. It depends on your specific situation, your specific preferences. Do you prefer to have a more predictable payments as far as premiums, co-pays, deductibles, drug prescription plans? Or do you want to chance it with the employer sponsored program, which is definitely more volatile than the Medicare plan? Like I said, the CMS regulates that, so they are going to control the cost as much as possible. So the concerns that you have, like the dental, the vision, write those down. It sounds like you've already done that, and have those specific questions and numbers ready for that ship advisor. And I think they will love you for it, that you're actually coming to them prepared, because a lot of people are totally clueless. And on their defense, I mean, our whole healthcare system is complicated.
Yes.
But and then you can wrap your head around those questions, think about it, come back with some more questions, and we'll hammer those out again. But I know you said that open enrollment started yesterday.
Yes, and it's
but
on.
You do have a little time.
Yeah, it's open until the 31st.
Okay, so we have a little time. You definitely don't want to make rash decisions, because they can literally cost you thousands.
Right.
And so you're stuck with that decision until the next enrollment period.
Mm-hmm.
But yeah, if the vision and dental is gonna outweigh leaving, that's a pro for staying with that. But you got to look at how much is your premium coming out of your paycheck every other week, and then when you actually go use it, the co-pays and deductibles, how much are those compared to what the prospective Medicare plan would be?
Mm-hmm.
And again, I can't talk up the SHIP program more. It's free. These people are specially trained, and they do this all day long, and they're not selling any products. So
Mm-hmm.
I know some people that do sell products, and they will explain the information to you, but they're salespeople. The advisors in the SHIP program are not.
Yeah.
And I think after having this primer, you'll be better informed to listen to them and make informed decisions.
Mm-hmm.
So have I cleared up anything for you? I hope I have.
Well, let's just say I'm not more confused.
Oh, well, that helps me. I feel better about that. I feel better about that.
It's just still just difficult to understand, because it just seems like is a trap that they're trying to put you in. That's why, like you say, you have to be very well informed.
Yes.
And it's like it's like a catch-22. Either you get it or you don't get it. And then if you don't get it, this happens. If you do get it, then it's just a lot of not. It is confusing. It is confusing.
And there's a lot of decisions that you have to make.
Right.
And for the audience, whether you're listening on the podcast or whether you're watching this on YouTube or any other social media, my client is about the typical person facing this. She is an educated woman. She has a couple degrees. She's been involved in the medical field, and she still has a lot of very valid questions. So make sure that you get some help. Make sure that you, if you want to watch my videos, great. I'll put links to further resources that help explain this stuff. But again, make sure that you talk to an advisor. Make sure that you talk to the SHIP program for your state. And don't wait too late. If they tell you for 3 months, hey, you're going to have a choice to choose Medicare, don't wait until the 11th hour. Mm-hmm. Then you definitely won't be making informed decisions. Rhonda, do you have any other comments or questions?
No, that's it. I guess the what is the word? And it's not a dilemma, but I mean, I'm at, soon to be 65.
Mm-hmm.
And I can work until I'm vested with this company, but that means I would need to work another 7 more years. I don't want to work to my 70s to be fully vested.
Right.
You have to have 10 years. So, and I'm, just contemplating, when am I going to retire?
Mm-hmm.
Knowing that if I have Medicare, then the Social Security that I'm going to have, how much will be taken of that because of the Medicare, and
right.
Just some things that concern me that I certainly don't want to worry about.
Well,
but it's all coming together. That's what it is. It's all coming together.
Well, that's a good thing. I'm glad to be part of the solution. And millions of people have done this before. So the emotions that you're going through, the questions that you're having are legitimate, and millions of other people have had the same questions and concerns, and a lot of them have found solutions and help by getting advice from trusted advisors and becoming informed consumers and making informed decisions. So I applaud you for doing your due diligence early. And I'm sure that it will all come together and you will be able to make the most informed decision that you can. And then you get as close as you can. And then the next year, through experience, you'll be able to fine tune it a little bit more. But I would get those specific numbers, have them written down, and talk to that SHIP advisor. And I'll give you that contact information. And for the viewers, I will have that link in the description below for the YouTube channel.
Okay.
All right. Any more questions? You can contact me anytime.
Yes, that's it. I think I've asked my most pending questions.
All right. Well, those are the kind of critical conversations that we have here on the channel. As we sign off, this is Walt Kasmir, leading gerontologist and certified senior advisor. Questions and comments, let me know what you think. Give me your questions. Don't forget to like, share, and follow. We need to be able to help more people with these same and other questions. So until we meet again, be blessed.